Hi, today with the help of my little friend here, I'm going to be going over the skeleton. So the main connective tissue components of the skeleton are the bones, cartilage, tendons, and ligaments, the latter three, which articulate and connect to those bones. The skeleton is subdivided into two regions, and bones are classified according to their shape. The 7 bone classifications are sutural or Wormian. These are small, oddly shaped flat bones that lie along the sutures of the skull. We also have flat bones, which are the skull bones themselves. These are more or less parallel layers of compact bone with a spongy layer sandwiched in between. The spongy layer is also called diplo. We also have pneumatized bones, which are hollow or contain many air pockets. An example is the ethmoid bone. Next, long bones are typically the most recognizable for most people. The limb bones are great examples. They are long and slender. They have a diaphysis within which there is a medullary cavity or marrow cavity, 2 metaphyses, and 2 epiphyses. Short bones are cube-like and include the metacarpals and the metatarsals. Sesamoid bones include the kneecap and are small, round, flat bones that are typically found around joints or embedded in tendons. And finally, we have irregular bones, which this is a category that's a catch-all for other bones with more complex shapes. They may have more prominent ridges and notches and just don't fall into those other categories. A vertebra is a great example. So there are 206 bones in the adult body. 80 of them lie within the axial skeleton and 126 within the appendicular skeleton, which are those 2 subdivisions I mentioned earlier. We'll start with the axial skeleton, which consists of the skull and associated bones, the vertebral column, and the thoracic cage. The skull itself can be divided into the neurocranium, which are the 8 bones that actually surround and protect the brain. So before I take that off, we actually have the frontal bone, the 2 parietal bones, the occipital bone, the 2 temporal bones, and then opening this guy up, we have the sphenoid, which is that batwing-like bone. You can see the sella turcica within it, and anterior to that, very hard to see in this resolution, I'm sorry, is the cribriform plate and the crista galli of the ethmoid. The other portion of the skull is the viscerocranium, or the facial bones. These include the 2 maxillae, the mandible, the 2 zygomatic bones, the lacrimal bones that are in the medial part of the orbit, the 2 nasal bones, the palatine bones, which comprise part of the orbit, and if we open up his smile here, where that spring connects to his soft palate, is another portion of the palatine bones. Finally, we have the vomer as well, which is a bone between the superior surface of the maxilla and the inferior line of the perpendicular plate of the ethmoid. And finally, the 2 inferior nasal conchae, not visible on this model, but would be within the nasal cavity. The associated bones of the skull are the hyoid bone, often called the Adam's apple in guys. It is also not on this model because it does not directly connect to the skeleton. It is actually suspended by the stylohyoid ligaments and would be about right here. The 6 other associated bones are the auditory ossicles, 3 on each side in the inner ear. Moving on to the vertebral column, we have first the 7 cervical vertebrae. C1, 2, and 7 are special in that C1 is the atlas. This holds up the skull and forms a very important articulation with the occipital condyles of the occipital bone that allow us to move our heads up and down. C2 is the atlas, or is the axis, which articulates at the dens with the atlas, and that articulation allows us to rotate our heads and move them side to side. C7 is the vertebral prominence. This has facets that are the attachment points for many muscles, and it's also the origin of the ligamentum nuchae, which allows us to hold our heads upright with less muscular effort put into that. The 12 thoracic vertebrae each articulate with the ribs. So I'm going to pause and note the thoracic cage before we move on to the rest of the vertebral column. There are 12 ribs on each side. Ribs 1 through 7 are true ribs in that they're connected directly to the sternum via their costal cartilages. Ribs 8 through 10 are false. Their costal cartilages fuse before meeting at the sternum. And ribs 11 and 12 are floating ribs. They only articulate with the vertebral column. The sternum itself consists of the manubrium, the body of the sternum, and at the inferior tip, the xiphoid process. And going back to the vertebral column, the next 5 vertebrae are the lumbar vertebrae. They, you'll notice, are much bigger than the cervical vertebrae. So as we move caudally, the amount of weight required to be borne by the spinal column increases. So the vertebrae at the caudal end need to be larger. Next we have the sacrum, which consists of 5 fused sacral vertebrae. And that fusion happens shortly after puberty. Similarly, the coccyx is 3 to 5 bones. The tailbone it fuses around age 26 in humans. And that's it for the axial skeleton. The remaining 126 bones lie within the appendicular skeleton, which comprise the limbs and their attachments. The pectoral girdle consists of the scapula and the clavicle. And it's important to note that the sternoclavicular joint is the only direct attachment of the pectoral girdle to the axial skeleton. Our arms consist of the humerus, radius, and ulna. Our hands, namely our wrists, consist of 8 carpal bones. From lateral to medial, the proximal carpal bones are the scaphoid, lunate, triquetrum, and pisiform. And the distal carpal bones are the trapezium, trapezoid, capitate, and hamate. Metacarpals are noted from lateral to medial by Roman numerals 1 through 5. The thumb has 2 phalanges, the distal and proximal. The thumb is also called the pollex. And each of the other 4 digits have 3 phalanges each, the proximal, middle, and distal phalanges. Moving down to the pelvic girdle, that is the attachment, that's also known as the hip bones. That's the attachment for the lower limbs. The hip bone actually consists of a fusion of the ilium, ischium, and pubis on each side. Their meeting point is also the acetabulum, which is the articulation point for the head of the femur or thigh bone. Moving down to the knee joint, you can see the sesamoid bone here is the patella. This larger bone is the tibia, and it's the weight-bearing bone of the lower leg. The more slender lateral bone is the fibula. These both articulate with the ankle joint at the talus, which is one of the carpals, or tarsals, excuse me. The heel bone is the calcaneus. And moving lateral to medial, we have the cuboid and the navicular. Distal to the navicular are the 3 cuneiform bones, the lateral, medial, lateral, intermediate, and medial cuneiform bones. Similar to the hand, the metatarsals are noted 1 through 5, moving medial to lateral. And the big toe or hallux has 2 phalanges, the proximal and distal, and the other 4 toes have, similar to the phalanges of the hand, proximal, middle, and distal phalanx each. So I believe those are all the bones of the human body. As you know, I do want to be a veterinarian, and I did research one particular category of infectious pathogens that afflict bones. These are called bacterial osteomyelitis or arthritis in poultry, so namely chickens and turkeys. It's usually Staphylococcus aureus or E. coli that cause these infections of the bone that present as lesions in the femoral head or the tibiotarsal end of the leg. This can cause swollen joints, lameness, and there's one particular bacteria, Enterococcus cicorum, that can cause enterococcal spondylitis, which leads to leg paralysis in these birds. All of these different bacterial strains that cause bone infections are fatal to these chickens because they inhibit normal behavior and access or ability to reach food. And additionally, the response to antibiotics in existing cases is extremely poor. So prevention of spread is extremely important. So even if you're not an animal person or extremely into veterinary medicine, this is relevant too because a lot of these infections can easily spread and be rampant in poultry facilities where, a lot of people get their groceries from eventually. All right, well, thank you for tuning in.